All right, well, how does Obamacare affect us? 23 ABC's Christine Din spoke to those in the healthcare industry and residents to get their opinion. Christine?
The Affordable Care Act will affect all of us in one way or another. The Congressional Budget Office says an estimated 32 million uninsured people will gain coverage under the Affordable Care Act. 23 ABC went to Clinica Sierra Vista to find people who would be affected by the law, which requires insurers cover the children of those they insure up to age 26. Helen Pena is one of those children. She was one of the first people we encountered.
Without Obamacare, I would have lost my health insurance last year when I was 23. Now I'm 24, but because of Obamacare, I get it to 26, and I'm very relieved about that because I just graduated college and I have all these bills to pay and stuff like that, so I wouldn't be able to afford insurance if it wasn't for that.
Next, we went to the waiting room. By the way, the law requires Americans have health insurance by 2014 or face a tax of up to 1% of their income. That's where Crystal Jenkins fits in. She's at the clinic for her son's doctor's visit. Her family has no insurance. She makes too much to be eligible for Medi-Cal, but too little to afford private insurance.
I feel that it's unfair to be taxed because if I wanted insurance, I would have it. And it's my choice and not the government's choice.
Kern Medical Center says about 1/3 of the county is uninsured. KMC participates in a pilot program that tests the provisions of the Affordable Care Act. They've taken people without insurance and assigned them medical homes, primary doctors, and care managers.
And yes, we have had success. We've seen about a 60% reduction in emergency department visits and about a 60% reduction in patient days. And the cost per person has consistently gone down over the 3 years of the most recent program.
KMC CEO Paul Hensler says having coverage does not mean having access, especially here in Kern County.
We have a tremendous shortage of physicians, nurses, other healthcare workers in many areas, hospital beds, and that shortage will continue and probably become worse.
The Affordable Care Act is ideally supposed to cut down costs nationwide in the long run, but locally it could be more costly.
From KMC's perspective, one of our biggest concerns is because we have a lot of undocumented workers in the area who will not be covered, I anticipate we'll continue to have a significant number of uninsured patients. The problem is that we won't be receiving the funding we previously received to help offset some of that.
Some local doctors are not convinced by so-called Obamacare.
It is beneficial for everybody, for doctors, for patients, and everybody else. My concern is if the government going to micromanage it, who's going to supervise them?
Now, people will also be able to shop around for policies through government-provided exchanges, kind of like how you use comparison websites online to buy airfare. In the studio, I'm Christine Din, 23 ABC.